Have you ever had an operation of any number? If not, then assume that you are lying on the hospital bed and your surgery is going on. During this surgery, you suddenly come to your senses on the operation table and you start feeling medical instruments tearing your body and going inside. Now don't forget that this operation is happening in front of your eyes, and now you are also feeling every pain that is arising from that operation. The truth is that such incidents are more common than you think. The data we have is going to show in a way that it is absolutely possible to be with anyone in future. So that's why watch this video till the end, because today we are going to talk about some people who have experienced this incident themselves. So without further delay, let's get started. Generally, before any surgery, the patient is given an injection of anesthesia. This general anesthesia does two things in our body. During surgery, the patient's body is unconscious. Example, it makes him unconscious that he does not feel the pain, and secondly, it does not let him create a new memory. But things don't stop here, because from here, the problem only starts. Their body is paralyzed due to general anesthesia. That is, they cannot move, and their pain or consciousness cannot manifest to any other person during the operation. They can even hear the voices around them. Everything is unconscious. Now, this situation is the most painful to endure this incident because during the surgery, the patient's mind is full of terrible thoughts related to surgery, and he also starts to realize all those things which are not actually happening. A story came up in which doctors had to remove both of her ovaries from a woman named Jeannie Smith. She came to her senses in the middle of this surgery, and she saw a shiny light on her face. Due to medications, Jeannie's body was paralyzed, and due to this, she was not able to say anything, and nor was she able to give any indication that the doctors would find out that she was in her senses. She was able to feel every cut and stitch and was enduring the pain that was happening to her. For her, this pain was such that many bombs were exploding in her body. She was getting nervous, and despite having a breathing tube in her throat, she was having trouble breathing, and she was feeling as if she would die in the middle of the operation. And this happened because the anesthetics that were being supplied to Jeannie's body during the operation, it ended up wearing off too soon, causing her to regain consciousness and experience a terrifying ordeal. But perhaps the most horrifying case of anesthesia awareness involved a man named Sherman Sizemore. Sherman Sizemore was suffering from severe abdominal pain. To determine the cause, doctors performed an exploratory surgery. Before the procedure, doctors gave him powerful paralytic drugs, which left him completely unable to move because his manspacia will be locked, but he was not given any anesthesia just because of an ordinary mistake, and the surgery was done in the same way for a full 29 minutes. During this time, he was in his senses and was seeing everything in front of his eyes, but he was not able to move at all. 16 minutes after the surgery started, as Sherman was stabbed in the stomach and he was cut, then the anesthesiologist realized his mistake. He felt the pain and immediately injected anesthesia into Sherman's body, but by then, it was too late. After the surgery was completed, as soon as Sherman woke up, he was in a state of fear. Whatever happened in the beginning of the surgery, he remembered everything, and this terrible experience was having a deep impact on his mind. For many days after the surgery, he could not sleep properly, and whenever he tried to sleep, he would have scary dreams of surgery, and sometimes he would feel as if people were burying him in the ground. He could not endure this anxiety for more than a day, and within a month of surgery, he committed suicide. In most cases, anesthesia awareness is due to the negligence of the anesthesiologist, or it happens when the doctor cannot properly assess the anesthesia demand of the patient's body, and they can't always accurately determine what's happening inside the patient's mind. Thanks to advances in medical science, there are now machines that can monitor a patient's brain activity during surgery and help doctors determine whether the patient is likely to regain consciousness. However, because these machines are expensive, they're only available in around 15 to 20% of hospitals. But if you ever need surgery, there's no reason to panic. There are simply a few precautions you can take to reduce the risk of anesthesia awareness. Before any surgery, the doctor takes information from his patient about his medical conditions, whether you are fit for that surgery or not, and how many anesthetics your body will need. Just keep in mind that you tell your doctor everything absolutely true and don't hide anything from him. If you do this, your chances of getting anesthesia awareness are greatly reduced. Even before the operation, inform your parents and doctors about this so that special care can be taken on this matter. And if for any reason you get anesthesia awareness due to the carelessness of doctors, that's all for today's video. If you like this video, then don't forget to like and share it.